Hi, I'm Marisol, and I chose to write my EDI paper about toxic shock syndrome. And throughout the paper, I'm going to refer to it as TSS just because it is hard for me to pronounce. So starting off, the reason I decided to do my paper on TSS is because when I first learned about TSS, and I don't know if this is just me, but when I first learned about it in my health classes through middle school and high school, um, I only knew it as women can get it through tampon usage, but that's not the case. So that is the reason why one, I wanted to learn more about it, and I did, and I just thought it was interesting to learn about. So TSS is rare, but it is life-threatening. It's caused by bacteria that produces toxins, and those toxins end up in your bloodstream. Um, it is often associated with women, as I said before, but it could occur still in men, women. I mean, men, obviously women, children, and elders. Um, it could occur through skin wounds, scrapes, burns, or surgical incisions. And there are two main bacterias that cause TSS, and I'm going to mess up these names, but it's okay. The first one being Staphylococcus aureus, which is known as a staph infection. And the second one is Streptococcus pyogenes. Um, I know I messed that one up, but these bacteria normally live around your skin, on your skin, around your mouth or your throat. Um, so as I said before, it occurs mainly in women, or it is known to mainly happen in women. That's just because in the 70s and 90s there was high absorbent tampon usage, which obviously isn't the case now. They've stopped producing those because it would cause TSS in women. But in the 70s and 90s, women would use high absorbent tampons, and sometimes women that had lighter periods and were using high absorbent tampons contracted TSS because the staph bacteria um, got trapped in the vagina and it's found its way into the uterus. It can also occur when women use pads. It's less likely, but it is still possible. It could also happen when women use menstrual cups or cervical caps. Um, Strictly looking at the Staphylococcus aureus, which is the staph bacteria that mainly affects women, which is known as menstrual TSS. And Streptococcus pyogenes affects people with recent strep throat or scarlet fever. This can be children or elders, elders meaning like 65 years or older when looking at TSS for them. TSS is important to learn just because there is a big lack of knowledge around how a person can contract TSS. Um, TSS can lead to death or organ failure, which can result in renal or liver failure. Fatality rates surpass more than 50% when it is misdiagnosed or when diagnosis is delayed. Diagnosis can be delayed because the symptoms for it, someone might not guess that they have TSS. So during my paper, I looked at this case study of a 12-year-old girl who contracted TSS through tampon usage. Um, Her symptoms were diarrhea, vomiting, lightheadedness, and sleepiness. And this was due to a swab of her tampon growing Staphylococcus aureus. And in elders, streptococcal pyogenes, as I said before, can occur in 65-year-olds or older. This is just due to them having a more weakened immune system at that age or recently having a surgery. Sorry. Um, it could also happen with viral infections that lead to open sores or other skin injuries as well. Chronic illnesses can also increase the risk for developing TSS. Those chronic illnesses can be known as alcohol use disorder or diabetes. The incubation period depends on the point of entry. There are 3 points of entry: the vagina, the nose, or the anus. Once the initial symptoms have occurred, hypotension develops within the 24 to 48 hours. As I said before, and I think this is just like one of the main things that I learned is through the symptoms. The symptoms are very common to having anything else. And as I said before, there is just a huge lack of knowledge when it comes to how someone can get TSS. And this paper, I could have made this video so much longer, but there is a time limit. So um, I just thought it was all interesting to learn about. Um, TSS is just something that I feel, especially women that use tampons, because although we did move away from high absorbent tampons, it can still occur. And I feel even though it hasn't, incidence rates are low and it hasn't happened in a while, it could still happen. And I feel that because it hasn't happened in a while, um, there just has to be more knowledge. And I feel that women coming into puberty that start using the menstrual cups or tampons or even pads, as I said before, there just needs to be more of a knowledge around TSS. And um, even, I mean, as I said before, everyone thought that it could only occur in women, but the fact that it also can occur in children and men and elders is another reason why knowledge needs to be more based on it and built up. Um, but that's all I've got. Thank you for listening and watching my video.